My husband and I decided that we wanted to expand our family. We decided to try and get pregnant when my oldest was about a year and a few months. We were lucky enough to get pregnant pretty easily. And around maybe 5 months, I had some elevated high blood pressure readings. And week 36, I was working that morning and I was going to go into my appointment. I started feeling some pain. I didn't think much of it. The pain continued. I went to the bathroom and noticed that I had some bleeding. I went to the nearest hospital by my house. They told me that they could not find a heartbeat. My son passed away, and it was a result, what they could best tell me was a partial abruption.
So when we talk about problems in pregnancy, preeclampsia is actually one of the most common medical problems besides diabetes and pregnancy that people have. People can have seizures from preeclampsia. That's called eclampsia. You can affect your kidneys. It can affect your heart, can affect your lungs, affect your liver. Preeclampsia is actually one of the most common reasons for an iatrogenic premature delivery. If you're preterm, less than 34 weeks, you try, if the maternal disease is stable, to prolong the pregnancy so that the baby can get the benefit of gestational age.
When my husband and I decided that we were going to try and have another child, I wanted to make sure that I sought care that could appropriately treat me. I came across Dr. Rana in her program at University of Chicago. I started looking more into the program, and I decided to reach out for a consultation.
A lot of times as clinicians, we have a diagnostic conundrum. So we get patients who have perhaps hypertension, some symptoms of preeclampsia, and we are trying to figure out, especially preterm, what is this person's risk to develop preeclampsia with severe features? Because the path to management can be very variant, right? So if I go left, which is a path that this person has severe disease, may develop severe disease, I need to deliver her, or path on the right, say, no, her risk is low, I can continue her pregnancy. So I personally feel this test will help me figure out which path to take. And it's really based on much stronger science that all these other tests are telling me. So all other clinical tests are less accurate.
So she explained that there was a test that was available that would be able to predict if you were likely to have severe preeclampsia. I, of course, agreed to do the test and was relieved to have that option. Whether good or bad, it was going to provide me and my doctor with more information. Around 32 weeks, I started getting some elevated blood pressure readings, and then I had elevated liver enzymes. They decided to have me go to the hospital to administer the test. The results came in, and she gave me a call. She called me late at night and said, I hope I'm not bothering you. I said, you're absolutely not. We want to know. And she told us, your numbers are low, and so that's a good thing. That means that you're not likely to have any kind of severe preeclampsia. And so that, gave her the information to decide, hey, we're going to continue waiting. It allowed the baby to stay in the womb a little bit longer and further develop.
I think just for reassuring our patients, this is a great test, whether it's a positive or a negative test, that I have this really specific test that I can tell you to the best of my knowledge how this pregnancy is going to go in the next 2 weeks, 4 weeks. So I think to me, that's the biggest benefit.
I think this test was very helpful because of my history and having had a loss. If this test was not available, I do think that I probably would have been delivered. Given that my son needed to stay in the NICU at 35, I can only imagine what would have been the case if he'd been delivered at 32. My son's name is Santiago Benjamin. He's healthy and just starting to learn the world.